third degree AV block as initial presentation of Lyme carditis by Muftauddin Idrisu and Alejandro Sanchez Nadales. Lyme disease is a multi-systemic disease caused by the bacteria Borrelia burgdorferi. It has different stages and clinical manifestations, and Lyme carditis occurs in the early disseminated stage of Lyme disease. Surveillance data shows that Lyme carditis occurs in 1% of patients with untreated Lyme disease. Our case is about a 24-year-old male with no past medical history, very active at baseline, who presented to our emergency department complaining of a 2-day history of generalized weakness, dizziness, headache, and blurry vision. Upon further interrogation, patient reported that he traveled to Minnesota for a lake trip where he spent a lot of time outdoors. He also noticed 2 weeks later, after returning from the trip, a diffuse non-target erythematous rash on his left anterior thigh and myalgia, which resolved with Tylenol. So during our initial evaluation, patient was found to be very bradycardic with a heart rate of about 40 beats per minute. Labs were ordered, which showed elevated erythrocyte sedimentation rate, C-reactive protein, troponins were normal, white blood cell count, magnesium, potassium were all normal. EKG showed left axis deviation with complete AV dissociation with a ventricular escape rhythm around 40 beats per minute. So considering his epidemiologic history, clinical manifestation, and EKG findings, there was high suspicion for Lyme disease and Lyme carditis. So Lyme serologies were also ordered, and patient was started on empiric IV ceftriaxone, placed on telemetry monitoring and transcutaneous pads also. 2 days whilst on empiric ceftriaxone, his cardiac conduction showed improvement from the initial 3rd-degree AV block to a 2nd-degree block, then 5 days later to a 1st-degree AV block. The Lyme serologies later came back positive, and confirmatory Western blot test for Lyme disease was also ordered. Patient completed his course of ceftriaxone and was discharged on oral doxycycline with follow-up with cardiology. Treadmill stress test was done during his follow-ups and was found to be normal. Subsequent EKGs also showed normal rhythms with no AV blocks. So, as a conclusion, diagnosis of Lyme carditis is established with epidemiologic and clinical features in conjunction with positive results of Lyme serologic testing. Symptomatic patients should be hospitalized, monitored with cardiac telemetry, and treated with IV antibiotics. Empiric treatment should be started if there is high suspicion for Lyme carditis. The prognosis of Lyme carditis is good among treated patients. Thank you.